think the work that is being done by AAKP is so critical to patients all around the country. Their ability to advocate on our behalf ensures that everybody understands the impact of kidney disease and what they can do to help us.
Now everybody is fully understanding that to achieve a better quality of life, you really need to listen and take into consideration what the patient views as a better quality of life for them.
I always have fun at an AAKP event. How could you not have fun? You're with people who understand completely what you and your family are going through. So it's not just for patients, AAKP. AAKP should be for the family of patients, because when a patient has kidney disease, the family has kidney disease.
Belonging to an independent advocacy organization like AAKP gives me the confidence that I can represent them and people living with kidney disease to represent them honestly.
Our objective over the coming decade is to reach people around the globe and not just limited to the United States, because kidney disease is a universal disease.
They encourage patients to be the voice for their care and treatment. And I don't see that as much in other organizations. And I feel like that is so necessary for patients to feel like they have a voice and they can make change in regards to their care and treatment.
It's important to be a patient advocate because to whom much is given, much is required. I was given this gift of life back in 2008 by my donor, Leanne, rest in peace. She was a deceased donor. So now if I can use my voice and use my platform and influence to impact lives, and my favorite word, why not? And why not become an organ and tissue donor today?
We spend a lot of time here, particularly in DC, in the nation's capital, talking with staff, with the legislators, and trying to help them understand exactly what the patient perspective is on anything that's kidney or renal related. It's a great honor to be able to do it. Our numbers are growing, and part of our strategy is for them to understand that we will come and visit and talk with them, and we represent the patient voice, and we want that to be heard, and that's how we do it.
People around the world who are sick and suffering with kidney disease need a voice of optimism, they need the tactics, and they need the reinforcement from fellow patients here in the U.S. to do what they do and demand a change in the status quo. And we fully intend to arm patients around the world with the tools they need to be more vocal with their governments, regardless of the ideology of their government, and to demand solutions and to defend private sector companies and investors who are willing to get into this space and deliver more innovation for patients.
AAKP opens the door so that it broadens the whole horizon. You're one person. When you belong to AAKP, you suddenly become a tribe.
Welcome to another HealthLine webinar from the American Association of Kidney Patients, titled Kidney Patients and the COVID-19 Vaccine. This is our first patient education event for 2021. Thank you so much for joining us today for important information regarding the coronavirus or COVID-19 vaccine and kidney patients. If you have been tuning into our webinars over the last 10 months, you have had access to information from AAKP's trusted federal partners like the Centers for Disease Control and Prevention, the National Institutes of Health, the Food and Drug Administration, and other key allies, including transplant surgeons. My name is Erin Kale, and I am Director of Stakeholder Operations for the American Association of Kidney Patients. I oversee our patient education and grassroots engagement activities, including our Ambassador initiative, which comprises highly motivated and engaged patients and caregivers around the country and the globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services assistance programs, and access to new products and services. This is especially true during national emergencies such as the coronavirus pandemic. In early 2020, as the COVID-19 pandemic evolved, AAKP changed all 2020 events to free virtual access, prioritized COVID-19 topics, and implemented strategies to involve a wider audience. Over the past 10 months, AAKP has broadcast expert COVID-19 insights through 1 global and 2 national virtual events, a dozen webinars, and launched advocacy campaigns to highlight disparities in minority and kidney patient representation in COVID-19 clinical trials and vaccine distribution protocols. AAKP leadership has participated in numerous webinars discussing remedies for disparities in these areas I just highlighted. In fact, in 2020, over 24 AAKP patient advocate leaders received the nonpartisan President's Volunteer Service Award for their efforts to educate kidney patients on the risk posed by COVID-19. For nearly 20 years, this national award has recognized volunteer leaders who have made a substantive impact on some of the most critical problems facing the nation. Throughout 2021, AAKP will continue to honor our obligation as the largest kidney patient organization in America to provide timely education to kidney patients and their families. I'd like to introduce AAKP's President, Richard Knight, and invite him to say a few words. Richard is a kidney transplant recipient who spent time on in-center hemodialysis. Richard?
Thank you, Erin, for that kind introduction. As we all know, coronavirus has been a serious threat to all Americans, especially those with underlying health conditions and who are immunosuppressed, like kidney patients. I pray for everyone who is facing or has faced the threat of this disease. It is constantly on our minds. I am asking all who are listening to stay connected to AAKP and to share your involvement in our online efforts, because although our reach is growing, we believe we need to educate more patients on how serious this virus is and the threat that they face. In 2020, AAKP volunteers enhanced the organization's national and global reach. How do we do this? We accomplish this by our unique virtual platforms, developing international patient group partnerships, writing clinical journal editorials, television, radio, social media, and our ever-growing Patient Ambassador initiative. We are flattered by the growing number of ambassador programs throughout the kidney patient arena. But the uniqueness of our Patient Ambassador initiative remains because it is led by patients who remain an integral part of AAKP. Viewership for 2020 AAKP programs now exceeds 80,000 people across 70 countries and is rapidly growing. International and national program faculty has included 90 medical practitioners and researchers and 60 patient experts. The AAKP Global Summit on Kidney Innovations, conducted in partnership with the George Washington University School of Medicine and Health Sciences, alone reached over 20,000 patients and professionals worldwide in July of 2020. Until the vaccine is widely distributed and the threat of COVID has significantly decreased, we will continue to hold our annual programs and events virtually so individuals around the country and the world can participate easily and safely from the safety of their own homes. I will now ask my fellow transplant recipient and AAKP Chair of Policy and Global Affairs, Paul Conway, to talk about our survey research that led in part to today's call. And I should also mention that Paul is the liaison to the Centers for Disease Control, Health Infectious Control Practices Advisory Committee, HIPAC, and CDC is a long-standing ally of AAKP. Paul?
Thank you very much, Richard. The basis of our webinar today actually comes from kidney patients and the unique tools that AAKP has through survey research to find out what their concerns are about COVID-19 and ways to address it. One of the primary issues right now is vaccine distribution, but AAKP has actually been surveying our patients on COVID-19 related issues, fears, and concerns for the past year. What I'd like to do now is briefly go through a series of slides with you to show you some of the key insights that led to today's program and also formed the basis of much of our programming last year around COVID-19. On this slide, you can see a question that AAKP posed to patients at the close of 2020 at the start of the holiday season. At that time, AAKP asked our patient members whether or not they were more or less concerned about COVID-19 and the risks than they had been in March of 2020. As you can see here, nearly 80% of AAKP members were more concerned about COVID-19 than they had been at the start of the year. Only 12% were less concerned and 9% were unsure. The next question on this slide that was posed at that same period of time was, how concerned are you about the risks? And fully 71% of our members indicated that they had a strong concern about the risk of COVID-19. On this next slide, you'll see another question that AAKP posed to our patient membership prior to the holiday season. At that time, we were trying to figure out how much COVID-19 had actually impacted the planning of individuals in regard to the holiday season. And on here, you can see that nearly 75% of the respondents indicated that they had actually changed their plans for how they intended to celebrate the holidays with their family and friends. 12% had not made a decision just a few weeks before the holiday season began. Only 13% indicated that there was no change of plans due to COVID. And then we asked in the drill down what the specific concerns were and the specific impacts. And as you can see, over 60% of the patient respondents indicated that they had made the decision not to travel. In this slide, you'll see specific questions that AAKP asked to find out the practical impacts of COVID-19 on friends and family of kidney patients, and also the economic impact. In the first question in the top left, you'll see that 41% of those who responded to our survey indicated that a member of their family or a close member in their circle of friends had been impacted by the COVID virus. Interestingly, on a second question that we asked on how COVID-19 was impacting patients, we asked whether or not the patients or a member of their immediate family had experienced a layoff or job loss due to the economic impacts of COVID-19. 32% indicated that they either knew somebody or they themselves had experienced a layoff or a job loss. 65% indicated no. What's interesting to us is fully 1/3 of kidney patients that were responding in this survey at the close of 2020 had already been impacted by COVID-19. In this next slide, we asked patient respondents whether or not they were planning on getting the COVID-19 vaccine when it was made available to them. 75% said yes, 7% said no, and about 18% indicated they were uncertain. That uncertainty is one of the things that AAKP is going to be focusing on in terms of patient education to increase that number, and we will also seek to educate those who are saying no to make certain that their concerns are allayed and that they hear from medical experts on the need to get the vaccination. On this slide, our last slide, we asked those patient respondents whether or not they had already received the vaccine. Only 14% indicated yes, 86% indicated no. Now, the mix of patients here are both transplant patients and dialysis patients, and those who are suffering from chronic disease who have not experienced kidney failure yet. So we have a lot of work to do. 14% of those who are eligible have received it. 86% of those who could receive the vaccine have not yet received it. And this is the charge for the kidney community. We must work as patients and as professionals together to make certain that we educate patients on the need, and we also educate patients on where they can go to get a vaccine once it becomes available in their area, and what to look for in terms of reactions and impacts so that they can keep their medical professionals fully informed. Again, these are some of the data insights that we're able to develop through AAKP's Center for Patient Education and Research. These are the same types of insights that we provide to elected leaders on Capitol Hill in both the House and the Senate and their staffs. And these are the types of insights that we share with elected leaders and appointed leaders in the new administration of President Biden and Vice President Kamala Harris. We've provided these insights in previous administrations throughout the presidential transition process, and we'll be kicking up the speed of our delivery of data throughout 2021 as the new presidential team comes into place and begins deliberating the crafting of their own kidney policies. But in the meantime, on this particular issue of COVID-19, you can trust AAKP to stay actively engaged and to make certain that the concerns of kidney patients, whether they run from clinical trials to vaccination, are fully represented in every major policy decision that's made, both in the private sector, in the research sectors, and in the federal government. Thank you very much for joining us today, and I'll throw it back over to Erin.
Thank you, Paul. I'd now like to introduce Dr. Deidra Cruz. Dr. Cruz is a board-certified nephrologist and the professor of medicine in the Division of Nephrology at the Johns Hopkins University School of Medicine. She is Associate Vice Chair for Diversity and Inclusion in the Department of Medicine. Her core area of research addresses disparities in the care and outcomes of chronic kidney disease. We are so pleased to have Dr. Cruz join us today. Dr. Cruz, I turn things over to you.
Thank you, Erin, and thank you, AAKP, for the invitation to be with you all today. As was said, I'm Deidra Cruz, and I'm really pleased to share with you all today a bit about COVID-19 vaccine basics that are pertinent for kidney patients. So when it comes to kidney disease and COVID-19, what we've seen is that Americans living with kidney disease, and especially people who are treated with dialysis or who have received a transplant, have been at increased risk for severe infection from COVID-19 and have also been at increased risk of hospitalization and death. And so it's really important now that we have vaccines available to think about how those vaccines may be able to prevent COVID-19 illness among people living with kidney diseases. For many of us, we've been concerned about how quickly it seems that the vaccines that are now available have been developed. But as it turns out, they have actually each undergone all of the 4 phases that are typically undertaken when it comes to the approval process for vaccines or any drug, really, that the Food and Drug Administration or the FDA approves. So meaning that for each one of these now available vaccines, they first started off with a phase 1 portion of the clinical trials that were conducted, where around 20 to 100 healthy volunteers were included, and issues surrounding safety of the vaccine was tested in those individuals. They then went on to phase 2, where several hundred volunteers were involved, and questions such as what are the most common short-term side effects of the vaccines were examined. And then they moved to phase 3, where thousands of volunteers were included. And it's here that in clinical trials that we can then look at whether the drug, or in this case the vaccine, is actually doing what the investigators hoped that it would do. And so in this case, looking to see whether the vaccines led to a reduction in COVID-19 infection. And then finally, once the vaccines or any type of drug that the FDA approves, once it's approved, then it goes into phase 4. And it's in this case that it's been demonstrated to be safe and effective, and that the benefits outweigh the risk. And so that's where we are with the available vaccines. And so as you may have heard, the available vaccines for COVID-19 are messenger RNA vaccines, or mRNA vaccines. So what are these mRNA vaccines? So these are types of vaccines that carry genetic material that actually teaches our cells to make a harmless piece of a spike protein. And the spike protein is found on the surface of the coronavirus virus, or the SARS-CoV-2 virus. And this is genetic material from the vaccine that ends up being destroyed by our cells once copies of the spike protein are made and it's no longer needed. And so cells will display this piece of spike protein on their surface, and an immune response is then triggered inside our bodies. And this produces antibodies to protect us from getting infected if the coronavirus enters our bodies. And so important to note that when it comes to mRNA vaccines, they actually do not affect our DNA, and they do not enter the cell nucleus. And these types of vaccines cannot give someone COVID-19. And while for many of us, this may seem like a very new technology because maybe we hadn't heard about mRNA vaccines, as it turns out, these types of vaccines have been studied for other viruses, including influenza, the Zika virus, rabies, and also CMV. And so there have been COVID-19 vaccines that have now reached Food and Drug Administration emergency use authorization. The two are the vaccine developed by Pfizer and BioNTech, which was demonstrated to be 95% effective at preventing COVID-19 infection, and the Moderna vaccine that was demonstrated to be 94.5% effective, so extremely effective vaccines, particularly compared to some vaccines that we may be more familiar with, like the influenza vaccine, which has been actually less effective at preventing influenza. Now, both of these are mRNA or messenger RNA vaccines, and they include a 2-dose schedule. And these doses are separated by 21 days and 28 days, respectively. The duration of protection against COVID-19 is actually not yet known. There are ongoing analyses of the clinical trials that were conducted for these vaccines to help us to understand how long this protection will last. And this will have important implications for things such as whether people who receive the vaccine will need to be vaccinated again, and if so, when? So after what period of time? Will it be 6 months, a year, or longer, for example, before someone would need to be vaccinated a second time in order to continue to have protection? But both vaccines were tested in diverse adult populations that included older adults and also included individuals from communities of color. For example, 9% in one trial and 10% in another included participants who identified as Black or African American. There has not been data yet on whether people with kidney diseases were included in the trials for the Pfizer or the Moderna vaccines. The Moderna study did, we know, include 9.5% of individuals who had diabetes, which, as you know, is one of the most common causes of kidney disease. And so we know that these mRNA vaccines are expected to produce some side effects after vaccination. And this is especially the case after the second dose. Some of the most common side effects include fever, headache, and muscle aches. There have not been significant safety concerns that have been identified in the clinical trials that were conducted for these vaccines. And at least 8 weeks of safety data has been gathered for the trials that have been conducted. And it would actually be considered unusual for side effects to appear more than 8 weeks after the vaccination. You'll see on the right a picture of me getting my vaccine, my first dose. And I had minimal side effects, just some soreness in the arm where the vaccine was injected, and that went away within 2 days. And so both the Pfizer, BioNTech vaccine investigators as well as the Moderna vaccine investigators did report on the side effects that were reported among participants of their trials. So in the case of the Pfizer one, pain at the injection site was the most common reported side effect. There was some redness and swelling at the injection site for some individuals. Fatigue, headache, muscle aches, and chills were also reported and were the most common sort of systemic responses or responses that happened all over the body. All of these side effects were noted to have been worse after the second dose of receiving the vaccine. And after that second dose, fever was reported in up to 16% of the participants. Notably, younger adults, as compared to older adults, were more likely to have these sorts of side effects. When it comes to the Moderna vaccine, again, they reported slightly more severe side effects or more frequent occurrence, not severity, but more frequent occurrence of side effects among the younger adults. They were, again, mostly pain at the injection site, and for some people included some swelling, including some swelling of the lymph nodes or lymphadenopathy and some redness. And these side effects were worse after the second dose. You can see that there was a difference again between these age groups for the older adults greater than 55 years of age, they had fewer of these initial type of symptoms, including sort of the pain at their injection site, than did the younger individuals. But again, there were reports, though, of fatigue, headache, myalgias, and arthralgias, as well as around 10% of the recipients of the Moderna vaccine who were in this age group did report fever. And so safety, of course, is always a concern. And for anyone who's thinking about receiving the vaccine, it's important to note that this vaccine has already been undergoing the same sort of safety processes that is the case for all of the vaccines and medications that are approved by the Food and Drug Administration. And so here, what's been tapped into are these existing systems and data sources that are used to monitor the safety of vaccines after they've been authorized for use, including those listed here. There has also been a new system that has been developed in order to monitor COVID-19 vaccine safety, in specific one called vSafe, and it includes active surveillance that uses text messaging to initiate web-based survey monitoring. So here, individuals who enroll in vSafe are then able to send in a text message if they have symptoms, and those are being tracked and will be periodically reported. And then these same individuals enrolled can provide telephone follow-up as well, or are provided telephone follow-up should they develop medically significant adverse events. So when thinking about who should or should not get the vaccine, in the category of should get the vaccine, really everyone who is eligible should probably get this vaccine. There unfortunately are no data yet on kidney patients specifically, but given the risk of COVID infection, including the risk of hospitalization and death that I mentioned earlier, the potential vaccine benefits are quite high. And those who have had prior COVID infection should also get the vaccine. What is recommended is that they wait 90 days after they first develop symptoms from that COVID infection, or were first told that they had COVID infection, before getting the vaccine. The groups of people who should not get the vaccine it's a fairly small group, but it includes individuals who have a history of severe allergic reaction, including anaphylaxis, after having a dose of an mRNA COVID-19 vaccine, or for those people who have a documented allergy to one of the components of the COVID-19 vaccine, including those who may have an allergy to polyethylene glycol, or PEG. People who have had immediate allergic reactions of any severity to polysorbate as well should not get the vaccine, and that's because it kind of can have a similar response in those people to what it has for those who have an allergy to the ingredient PEG. The CDC, or the Centers for Disease Control and Prevention, has put forward priority groups for receiving the vaccine, but at the individual state level, states are following their own guidelines, in most cases in accord with the CDC, but with some nuances. The CDC, however, has put forward these 3 different phases, with phase 1A, including healthcare workers and both residents and employees of long-term care facilities. And then in phase 1B, frontline essential workers, including those working in the educational area, such as teachers and others who work in school systems, are prioritized, and also people who are more than 75 years of age. In phase 1C, people between the ages of 65 and 74 would be considered the priority group, and those who are between the ages of 16 and 64 who have underlying medical conditions, and also other essential workers, such as people who may have professions where they are interacting with lots of people on a day-to-day basis. And so where can you go to get vaccinated? This certainly varies by location, both on a city and a state level. But there are numerous options. Some health departments are administering the vaccines, pharmacies, and also health clinics. In some areas around the country, there are drive-through vaccination services being provided, Some employers are also providing vaccination to their employees, depending upon what sort of priority area those employees fall under. And then also some dialysis facilities across the country are rolling out vaccination programs for both their staff as well as their patients. And so there are some unknowns that remain about the vaccines that are important to highlight. The first is that, again, we don't know how long protection will last from the vaccines. We also don't know if boosters will be needed in the future, so meaning an additional dose of the vaccine in order to continue to allow those antibodies to be produced by the body and protect us from COVID-19. We don't know whether these vaccines will prevent asymptomatic infection. So the clinical trials that were conducted and have been reported included COVID-19 infection where those individuals actually had symptoms of COVID-19. But we don't know, because it wasn't part of the design of those clinical trials, whether the vaccines prevent the infections with COVID-19 that don't necessarily produce symptoms. There are many subpopulations of individuals in which we don't know about efficacy of these vaccines, including people living with kidney diseases. And we also don't know if these vaccines prevent transmission of the SARS-CoV-2 or COVID-19 to susceptible individuals. So meaning we don't know if once a person has been vaccinated, if that means that they can't spread COVID-19 to another person. And so it is important and continues to be important for us all to continue to wear masks and also physically distance to continue to prevent the spread of COVID-19 infection. And so to summarize, COVID-19 has disproportionately impacted people living with kidney diseases. 2 vaccines are now approved for COVID-19, and studies of the vaccines have not yet reported results for people with kidney diseases. Yet most clinicians do still recommend that their kidney patients receive the vaccine given the risk of COVID-19 infection to people who are living with kidney diseases. I thank you for your attention, and again, thank you to the AAKP for this invitation.
Thank you, Dr. Cruz. I'd now like to introduce Dr. Michael Allen Rees. Dr. Rees is a transplant surgeon and professor at the University of Toledo Health Science Campus, departments of Urology and Pathology. His areas of interest include renal transplantation and kidney paired donation. In 2006, Dr. Rees founded the Alliance for Paired Kidney Donation, producing the first non-simultaneous pay-it-forward chain of transplants in 2007. And he carried out the first global kidney exchange starting in 2015. AAKP honors Dr. Rees in 2021 with the AAKP Medal of Excellence in the Transplant Surgeon category. Dr. Rees, thank you so much for joining us today. I now turn things over to you.
Hello, my name is Michael Rees, and I'm a transplant surgeon at the University of Toledo Medical Center. But I also hold a PhD in immunology from the University of Cambridge in England. So I'm pretty well versed in how the immune system responds to different pathogens. And today I'd like to talk to you a little bit about COVID-19. The reason I'd like to talk with you is because I'm really excited. I think it's a real testament to human ingenuity that we've been able to respond so quickly and come up with the wonderful vaccines that are now available to us, particularly the Pfizer vaccine and the Moderna vaccine, these mRNA vaccines. It's the first time they've ever been used in humans, and that makes everybody a little frightened. But I want to spend a little time talking with you about why I'm super excited about them. Typically, when we make vaccines, what we do is we take a piece of a protein, or we take an injured virus. But in some patients, like immunosuppressed patients who've had transplants, those injured viruses can still be harmful and even kill people. You know, when we first came out with vaccination, it was Edward Jenner back in the 1700s, and it was identified that we could overcome smallpox, which doesn't really exist today. But do you know, it used to kill 20 to 30% of the people that got it. And if you vaccinated people, it killed about 2 to 3% of the people that were vaccinated. And so we face this difficult decision. Do I take a 2 to 3% chance that I'm going to die for sure? Or do I take a risk that I'm going to get the disease and have a 20 to 30% risk of dying? Well, fortunately, that's not the situation with COVID. While lots of people have died from it, also there are lots of people who've had the disease and who haven't died from it. So this is really about patients at risk and about trying to get herd immunity. And what I'm excited about is the safety of the vaccine. It really hasn't had any serious side effects other than that people have gotten a little sick. You know, they get a fever or that hurts in their arm. But what I like to think is something like 16% of patients will have a bit of a reaction, a fever, or feel ill with the second shot. Nobody knows this, but I wonder if those aren't the very people that would get the sickest if they actually got the virus because of the response that they're having. Of course, we'll never know that, because the wonderful thing about a vaccine is it makes it so you're not going to get the virus. And in fact, another wonderful thing about this vaccine is that while it has clearly stopped a lot of people from getting any symptoms at all, because they really only measured people who became symptomatic, it stopped all but about 1 or 2 patients out of 30-some thousand patients from actually getting very, very sick from the disease and having to be hospitalized. So this vaccine really achieves what we want it to achieve, but it's doing it in a very cool way. And in fact, I'd like to tell you a little story now about why I think it's possible that the way we were forced into using this mRNA vaccine, because we could do it so quickly, may actually have opened up a faster pathway to these vaccines, which may one day help us overcome some cancers. So I think that's just a really exciting breakthrough. It's going to prove how safe these vaccines, millions of people have received them in the United States, and there's just not reports of a lot of terrible things happening. So let's talk a little bit about the mRNA vaccine itself. How does it actually work compared to using a virus that's been harmed in some way, so it's not thought to be very effective, or by using a piece of a protein? In this case, what we do is we actually can figure out what is it that the virus makes that helps it attack us, and what is it that when we make an immune response against it is protective to us. And we now understand that this virus has a spike protein on it. What we're able to do is to take the genetic material think of it kind of like the architectural plans for a house. The DNA is like the architectural plans for that spike protein. And what we do is we've packaged that. That's what the mRNA is. The messenger RNA is the message that allows the body to read that message inside of a cell and to create the spike protein. And when that spike protein gets produced, it gets produced in a way that makes our immune system be able to respond to it in just the right way to create the best type of immune response. So we've packaged that mRNA in such a way that it's covered with things that looks like the outside of a cell. And then the parts of the immune system that we want to recognize it and grab onto it will do that. They're called antigen presenting cells, but they can also get into other cells of the body, and that's what viruses do. They get into our cells and they start replicating themselves. But when we inject just the protein into people, it doesn't get inside the cell and made inside the cell. And that's important because our immune system responds in 2 particular ways to pathogens and to bad things that are trying to harm us. One is those things that come from the outside world, and the other way is from things that are made inside of our cells, like cancers or viruses. Viruses take over control of our cells, but they're actually made inside the cell. And we need to figure out how to get the immune system, which is outside the cell, to be able to see it. So this mRNA vaccine puts the mRNA inside the cell. The cell itself actually makes the protein, and then it can get processed in one of 2 ways. It can either get processed and go out to the surface of the cell and say, hey, I'm making this bad thing, and the immune system can respond to it, or that those cells can die and other cells can eat them and say this is outside of the body, and they can present it to another part of the immune system. But what they're showing the immune system is that spike protein And they're showing it in just the right way so the immune system responds and makes a very strong immune response, which then has memory, and we believe will protect us for a long time. But of course, we don't know exactly how effective it's going to be and how long the vaccine is going to work for us, and whether it's going to continue to be protective against the mutants that we see coming out, the mutations to the virus. But I think it's a testament, as I said at the beginning, to human ingenuity that within a matter of months, we were able to understand what is it that's infective and bad about this protein, to isolate just that little bit, and to put the mRNA into the right type of package so the immune system could take it in and then generate the appropriate immune response. And then it goes away because mRNA doesn't last very long. So it's not like if you inject a virus, that stays with you. If you inject a piece of protein, that stays with you for a long time. But if you inject this mRNA, it comes in, and the body's made to destroy mRNA very quickly, so it doesn't last very long, and it's gone. And all you have is a great immune response that's going to save a lot of lives. And so I highly encourage anyone who's watching this to get the Pfizer or the Moderna vaccine. And I would also encourage transplant patients to do that. But we're going to talk a little bit more now specifically about transplant patients and the safety of this vaccine for patients who are immunosuppressed. Thank you very much.
Thank you, Dr. Rees. I'd now like to introduce AAKP Board of Director member and Ambassador Dale Rogers. Dale is a transplant recipient, a former in-center dialysis patient, and has recently received the first dose of the COVID-19 vaccine. He is joining us today to share the conversations he had with his healthcare team when deciding whether or not to receive the vaccine. Thank you for joining us today, Dale, and I turn things over to you.
Thank you, Aaron, for that introduction. And thank you, everyone, for attending AAKP's webinar. I'd just like to say that I struggled back and forth with whether I was going to get the COVID vaccination or not, and I decided that I was going to use my patient voice to make my patient choice. So the first person I talked to is my local nephrologist, and my local nephrologist told me that he thought it was going to be beneficial for me to get the COVID vaccination. But then he said, I'm not sure when you should get that COVID vaccination, if you should get it right away, or if you should get it down the road after some testing has been done on it, and they know more about people that are immunosuppressed taking it. And so we both agreed that I was going to wait and talk to my transplant nephrologist and communicate with him on what his thoughts were on getting the vaccination, and then his thoughts on when I should get that vaccination. And on December 23rd, I had my yearly follow-up with my transplant nephrologist, Christopher Blosser out of the University of Washington. And Christopher Blosser, as soon as I asked him, he said straight out to me that the pros of getting the vaccination way outweighed the possibility of possible side effects of the vaccination. And talking a little bit more about it, he encouraged me to get that vaccination just as soon as I possibly could. Other conversations that I had with people about myself getting the vaccination, because I believed that each patient needs to educate themselves whether that vaccination is right for themselves or their medical professionals believe that they should get it at another time. I talked to my pharmacist. One of the thing that's talked about out in the world that you hear about is people's afraid to get the vaccination because it's a new process. And my pharmacist, when I talked to him, he told me this isn't a new technology. This is a technology that they've been studying for years and years. It was just they didn't know if they could use it on this type of process. But he told me that the vaccination was going to be beneficial to me. And he also told me that even more so than me getting the vaccination is to making sure that my caregivers and the people that surrounded me, like my family and friends, would be very beneficial to me if they got this vaccination, because then it would keep them from putting me at risk of themselves, any of them having it and being around me. So then at that point, I decided, wow, this is looking pretty strong towards that I should get it. At that point, I was pretty determined that I should get it. And then a fellow ambassador, Kent Bressler, he sent me a link. And this link went into detail about Fred Hutch Hospital in Seattle, and also Dr. Fauci talking about that a little cure of the vaccine was better than no cure at all, and just being out there walking amongst the COVID virus, meaning that if the normal person was vaccinated and had a 95% acceptance rate and coverage, that I, being immunosuppressed, may not have that. But even if I had 10% coverage, it was better than having no coverage whatsoever. And so after reading the article, after talking to my doctors and my medical professionals, I decided that the vaccination was right for me. So anyhow, as you guys have probably seen on Facebook, I chose to get the vaccine, and I put it up on Facebook for everybody to see. I go back for my second vaccination on February 1st, and I will also post February 1st on how that vaccination affected me. Because my first vaccination, it made my arm just a little bit sore, nothing to talk about, and that's just from the needle going into my muscle. And anybody that's been on dialysis, that's had their arm poked with the straws that they stick in our arms from dialysis, wouldn't even see this needle as being any big issue. But February 1st, I will take that second vaccination, and I will keep everybody on Facebook aware of how it's affected me. They tell me that the second vaccination has more possibility of me feeling symptoms from the vaccination, but I'm yet to find that out. So I hope that everybody has enjoyed and learned something from the webinar that AAKP's put on today, and use your patient voice to make your patient choice. Thank you.
Thank you, Dale. We appreciate you sharing with us today about your experience getting the vaccination. On January 12th, AAKP deployed a flash survey to our membership to ask about top concerns and questions kidney patients have about the vaccine. We will now address some of those questions. Dr. Cruz, I'll start with a few questions for you. Are the vaccinations as currently deployed safe?
Yes, I believe they are safe. And the way that I feel assured of that is because the process of developing them has gone through the same sort of series of steps that the Food and Drug Administration requires of any new vaccine or for any new medication for that matter. And these vaccines, while they seemed, I think, to most of us to have sort of appeared on the market pretty quickly, I think it's important to note that the technology that they use with the messenger RNA or the mRNA has actually been developed even before this COVID-19 pandemic. And so when this pandemic emerged, those researchers that had knowledge of this type of technology were able to quickly go into working to develop a vaccine. And so that's why that this sort of came to the fore more rapidly than what I think many of us expected. But then even after they had developed it, the process of walking through each of the 4 steps of being able to take a vaccine from the point of testing it out in a small group of individuals, all the way up to now being able to deploy it out into the broader population, really followed all of the steps that we see happen for any vaccine that the Food and Drug Administration approves. And so given that the safety profile is actually quite good for these vaccines, I do believe that they are safe.
Thank you for that answer. What are some of the side effects or reactions to getting the vaccination, and how common are allergic reactions?
So some of the most common side effects to receiving the vaccine include things located really at the injection site. So most people have the COVID-19 vaccine injected into the muscle, the upper part of their arm. And the most common reactions are just some pain there at the injection site, some muscle aches of that site. Usually those will disappear in just a couple of days, particularly after that first dose of the vaccine. There are reports of people after the second dose of the vaccine having more side effects, including some people having more generalized body aches from it, some people having fever from it as well. As far as severe reactions, including allergic reactions or even anaphylaxis, those were extremely rare in both of the trials, for both the Moderna vaccine as well as the Pfizer-BioNTech vaccine. And they are part of the reason why, for individuals who have a history of having anaphylaxis, they are actually being advised not to receive the COVID-19 vaccine at this time. But even in the clinical trials, those types of events were extremely rare. And so for most people, the side effect profile is quite good, and meaning that reactions to it are quite limited and quite mild.
Are the current vaccinations safe for CKD and dialysis patients? Has one vaccine over another been preferred for CKD and or dialysis patients? And can you tell us why?
So when it comes to the reports of the two available vaccines, including their reports of the clinical trials that were conducted for both of them, they did not provide information about how many individuals included in the clinical trials had kidney diseases. And so we actually don't know how effective it was for kidney disease patients or people with kidney diseases in specific. And so we do know, though, that for some of the people that were included in the trials, that they did have some comorbid health conditions, such as diabetes in some cases, some of the very common comorbid health conditions that people with kidney diseases may have. Some of those individuals we know were included in these trials. The Moderna vaccine, for example, did include 9.5% of participants who actually did have diabetes. But we don't know specifically about people with earlier stage chronic kidney disease or those with end-stage kidney disease, in that those people were not specifically reported upon in these trials. That being said, given what we have seen in terms of the impact of this COVID-19 pandemic on people with kidney diseases, it is still recommended that people with kidney disease, and maybe more so than others who may have other health conditions or those who don't have other chronic health conditions, should really pursue getting this vaccine, because the potential benefits of not having COVID infection are much more likely to sort of outweigh the risk of the receiving the vaccine, even though we don't yet have the specific data about people with kidney diseases. Certainly there is hope that there will be reports as the months progress and more people are receiving the vaccine. We certainly do hope that we will be receiving information about the impact and the effectiveness of these vaccines on individuals with kidney diseases. But certainly, I think the potential benefits of them really speak to a need for people to pursue them even now, while we're still gathering data about the vaccines. And then to the second part of the question regarding, is there a particular one of the vaccines that are currently available that is preferred for people who have kidney diseases? The answer to that is no. We don't have any reason to think that one of the vaccines over the other would be preferred for people with kidney diseases. And so, I would encourage people to receive the one that's available in their locale and that they're able to get the soonest of the two that are currently available.
Will the distribution of vaccinations change current protective measures recommended by the CDC, such as masks, social distancing, etc.?
So it's unlikely for the distribution of the vaccines to change those public health measures, masking, physically distancing, in the short term. But in the longer term, the vaccines are certainly the way that we get back to the previous way that we lived, where we didn't have to wear masks and we didn't have to physically distance. And so, but that will require a large number of individuals. Some estimates have been around 70% of the population to have been vaccinated in order for us to approach that place. And I think it will also require that we have seen that there's efficacy in terms of the long-lasting impact and long-lasting efficacy of these vaccines before we'll get to a place where we can do away with masks and do away with the physical distancing. And so, so unfortunately, it won't be an immediate sort of a solution to those public health measures that we've all been asked to follow.
Thank you, Dr. Cruz. We have one additional question for you. Will my dialysis center provide the vaccine, or will I need to go to my local pharmacy?
So it varies by location. In some cities, counties, states across the country, the vaccines are being rolled out in pharmacies, health departments, medical clinics. In other places, there are dialysis facilities that are providing the vaccines to their patients and also to the staff working there. And so what I would encourage anyone to do would be to ask at their dialysis facility what the plans are for being able to provide the vaccine to patients there, and also to take into account what the timeline is for that plan. It could be that for a given person that they may be able to receive the vaccine from another source, such as through their local health department or at a local pharmacy, prior to when it may be available at their dialysis facility. It'll be important that the first and the second dose are of the same vaccine. So if you receive a first dose that's a Moderna vaccine, you'll need to receive your second dose. It's also Moderna. But I would encourage people to go with the first available option, regardless of whether it's at their dialysis facility or through another source.
Thank you, Dr. Cruz, for answering some of these important questions that are on patients' minds. I'd like to now turn it over to Dr. Rees to address some questions as well. Are the current vaccinations safe for transplant patients? Has one vaccine over another been preferred for kidney patients? And if so, why?
Well, we don't have any evidence yet whether these new Moderna and Pfizer vaccines are going to be effective for transplant patients. I suspect that they will be safe for transplant patients, although I guess they haven't been tested, so we don't know if they're safe or effective yet. They've only been tested in normal patients, not immunosuppressed patients. So we really don't know the answer, but they work very well for normal patients. And I think the evidence is that these will be safe and effective for transplant patients. So I'm recommending all of my transplant patients receive either the Moderna or the Pfizer vaccine. I think these vaccinations are safe because the mRNA comes in and it just makes the spike protein. It doesn't make any other parts of the virus, so it can't make patients sick. Some of the inactivated viruses that are used for vaccinations, but they're live viruses, can actually make immunosuppressed patients very sick. So I don't recommend those for my patients. But something like this is a whole new way of doing vaccinations, and I think it's going to revolutionize how we do things, because we can figure out what the immune system needs to be able to respond. Then we can just get that little tiny bit, package it properly, put it into the right vehicle, get it into the body, and the body will then make exactly what we need the immune system to do to protect us. That is so exciting to me because we haven't really been able to figure out in many cases how to turn on the immune system to cure us from cancers. So I think it's likely that these mRNA vaccines, after we prove that they're safe and effective with COVID, we're going to start being able to personalize medicine. So if a patient gets a cancer, we'll figure out what it is that changed in the DNA to what went awry so that cancer cells could be produced, how the proteins were changed. We'll take that little bit of DNA that was responsible for that change, we'll package it inside as an mRNA and deliver it just like we're doing with the Moderna and the Pfizer vaccine, and allow the immune system to be turned on in just the right way that it makes an immune response against that little protein that went wrong. And then the body will be able to protect itself and kill the cancer cells that are expressing that mutated protein. And I'm really excited that this is going to get us to that point a lot faster than I think we would have had we not had this terrible scourge of COVID. So the second half of the question that you asked me was, is this better than other vaccinations? And I would say yes. I think the mRNA vaccine is going to prove to be safe because it will not get somebody infected, because all we're doing is building one protein that's not an infection. People might feel some symptoms from that, but that's their body is responding to the vaccine. But it's not a virus that's going to make people sick. So I feel like it's safe for my transplant patients. My only concern would be that if it's turning on the immune system, we're actually using immunosuppression to turn off the immune system so that they don't reject their kidney. And I think it will take a little bit of work to find out if there's any risk to the kidneys from immunizing patients. But so far, there's not very good evidence that immunization leads to increases in rejections. And so my suggestion is that patients do get immunized, and we probably should measure them a little more carefully after that to see if they've appropriately responded.
Thank you for that answer, Dr. Rees. Our kidney patients who are age 65 and older and also have comorbidities, are they also recommended to get the vaccination? And have there been any issues or concerns discovered among that population?
Absolutely. So patients who are over 65 and have comorbidities are exactly the patients who should be getting this vaccine, because they're the ones who are most at risk of dying from the COVID virus. So the studies have shown that elderly patients, I don't know that over 65 is all that elderly anymore, but having comorbidities, you're much more likely to die of COVID. And this vaccine has been 100%, almost 100% effective. It's at preventing people from dying. It's 95% effective at stopping people from getting symptomatic, but it's nearly 100% effective at keeping people from getting very sick and dying. So it's exactly the population of patients who are over 65 with comorbidities who should be getting this vaccination.
We have another question from a patient who says their kidney transplant is not functioning well. How will the vaccine impact my transplanted kidney? And should I still receive the vaccine?
Well, one of the things that we recognize is that patients who have kidney disease don't do as well if they get the virus as patients who don't have kidney disease. So that's one of the risk factors. So I would say that yes, you should absolutely get the vaccine, because again, you're at higher risk of dying if you get COVID.
What are the long-term effects of the vaccine, if any, on transplanted kidneys?
Well, that's a great question. We don't know is the answer. There haven't been long-term studies yet. We just started giving this vaccine to normal patients. We haven't really tested it in transplant patients yet. So the answer is we don't know. But what we do know is that it's nearly 100% effective at keeping normal people from dying from the coronavirus. So I think it's something that our transplant patients should be taking. The question is, will it be effective if the immune system has been treated in such a way to make it less effective? And if the immune system is less effective because of immunosuppression, will immunosuppressed transplant patients be able to respond appropriately? Maybe they'll need a couple extra shots. Time will tell, but I don't think we have to worry much about it harming the kidney. Other vaccinations have not led to much harm to transplanted organs. And I think my recommendation is that transplant patients receive this, and that thus far the long-term effects on the transplant kidney will be, while unknown, I would, if I was a transplant candidate, I would take the vaccine thinking that the risk was low.
Thank you, Dr. Rees. We have one final question for you. I am scheduled to receive a living donor transplant soon. Should I go ahead and get the first dose of the vaccine, or should I wait until after my surgery?
Well, that's a great question. I think my advice to you is that you should probably get your vaccine. It depends how long before you're going to get your living donor kidney transplant. If it's scheduled, if you think you're going to get the vaccination in the next month or two, I might delay your living donor kidney transplant so that you can be vaccinated before you've become immunosuppressed. Because if you're not immunosuppressed, then your immune system can mount an appropriate immune response, create memory, and give you long-lasting protection against the coronavirus. Whereas in the immediate period after receiving an organ transplant, many transplant centers in the United States use very effective means to stop the immune system from being able to respond to transplanted organs, but that also impairs their ability to respond to vaccinations. So you might be better off to get the vaccination first and then to receive the kidney transplant, or if you get transplanted, to wait a couple of months after the transplant so the effect of the very strong immunosuppression we use up front has been attenuated or reduced so that your immune system can respond better to the vaccine.
Thank you, Dr. Rees. We appreciate you being available today to answer some of these questions on kidney patients' minds. If you have a question that we did not get to during today's webinar, please reach out to us at info@aakp.org, and we will work with today's speakers to provide a response. We hope you have found this webinar informational. I would like to close with a few slides about additional resources and services that may be of interest to you. If you are not already a member of AAKP, we encourage you to join us. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, you can join online at aakp.org or by phone. To receive all of the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our printed magazine, AAKP Renal Life. We also invite you to follow us on our blog and on social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. By visiting our website and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download. And you can also order materials over the phone. As AAKP President Richard Knight mentioned earlier, AAKP's events in 2021 will be held virtually. We invite you to join us at the 3rd Annual Global Innovation Summit with George Washington University, our 4th Annual Policy Summit, and our 46th National Patient Meeting, and we encourage you to visit our YouTube channel to watch presentations from all of our past events. The recording of this webinar will be made available on our coronavirus resources page. For more patient resources on COVID-19 and to listen on demand to today's webinar or any of our previous webinars that we've hosted regarding COVID-19, please visit the coronavirus resource page on our website. You can access it from the link shown here or from the red coronavirus information button found on our homepage. We'd again like to thank today's speakers for sharing with us important information and questions to ask your healthcare team when considering the COVID-19 vaccine. Thank you again for joining us. Be informed and stay safe.